8 early signs of bone cancer you should never ignore. After the age of 50, some aches and pains may become a regular part of daily life. However, what if that persistent pain in your knees or lower back is more than just a minor discomfort? Bone cancer is a condition that develops silently, often showing subtle signs that can put your health at serious risk if not detected early. Today, we will discuss 8 initial warning signs of bone cancer that should never be ignored. Pay special attention to sign number 5. Many people mistake this symptom for arthritis, leading to delayed diagnosis and treatment. Recognizing these symptoms early can be crucial for timely medical intervention and better outcomes. 1. Swelling and sensitivity. Swelling related to bone cancer is persistent and often painful to the touch. Unlike common inflammation that may occur due to minor injuries, this type of swelling does not subside easily. The affected area may become increasingly sensitive, making everyday activities such as dressing or moving more difficult. In some cases, there may also be a sensation of warmth around the swollen area, which could indicate a more serious issue. If these symptoms appear, it is essential to seek medical attention promptly for clinical and imaging tests to determine the cause. 2. Lump or palpable mass. A noticeable lump or mass, especially near joints or specific bone regions, can be an indication of a serious underlying condition rather than a simple cyst or temporary swelling. The lump may gradually grow in size and become more evident when touched, often accompanied by a firm or hardened texture. As it enlarges, it may start pressing against nearby structures, leading to discomfort or persistent pain, even when at rest. Many people assume such formations will disappear on their own, but if the lump persists, increases in size, or becomes painful, it is crucial to seek medical evaluation. Diagnostic tests such as X-rays, CT scans, or MRIs are essential to detect potential abnormalities in the bones and surrounding tissues. Before the next topic, if you don't subscribe to our channel, you'll probably never see our videos again. If you already follow us, congratulations, you are getting closer to a healthy and long life. 3. Reduced mobility. Reduced mobility associated with bone cancer may initially appear as minor difficulties in performing everyday movements, such as bending down or climbing stairs. Over time, even simple tasks like walking or lifting light objects can become more challenging, leading to a feeling of stiffness in the joints and decreased control over the affected limbs. This limitation does not always come with intense pain at first, but tends to worsen progressively, making medical investigation necessary. As the tumor grows or causes inflammation around the bone, stiffness may increase further. 4. Bone fragility. Bone fragility occurs due to structural changes caused by the presence of a tumor, which weakens the bone and makes it less dense. As a result, the bone becomes less capable of supporting body weight and everyday activities. Inflammation in the affected area may further increase discomfort and reduce mobility, leading to a constant concern about avoiding sudden movements or falls. For some individuals, the first noticeable warning sign is an unexpected fracture that occurs without a clear cause. A minor impact or sudden movement may result in a bone crack or break, drawing attention to a problem that goes beyond a simple accident. If unexplained fractures occur, seeking medical evaluation is essential to rule out underlying conditions, including bone cancer. 5. Persistent bone pain. The pain associated with bone cancer tends to be deep and constant, unlike common aches that come and go with time or improve with rest. This type of pain often feels as if it originates from inside the bone, remaining present even during periods of inactivity. Over time, it usually worsens, sometimes becoming more intense at night, interfering with sleep. Additionally, this pain does not typically respond well to standard painkillers, which further highlights the need for medical investigation. Many people mistake it for arthritis or osteoarthritis, but the key differences lie in its intensity, persistence, and gradual worsening without an obvious cause. If bone pain does not subside, do not wait for it to go away on its own. Seek medical attention to ensure proper diagnosis and treatment. 6. Fatigue and extreme tiredness. Fatigue linked to bone cancer is not relieved by a good night's sleep or short periods of rest. Instead, it may persist or even worsen, affecting both physical and emotional well-being. Many individuals find that getting out of bed or maintaining their normal routine becomes a significant challenge. This exhaustion is often accompanied by a lack of motivation and loss of interest in activities that were once enjoyable. Several factors may contribute to this persistent fatigue, including chronic pain, the body's response to the tumor, and potential nutritional imbalances. Even moderate effort, such as a short walk or cooking, can lead to disproportionate exhaustion. If the body is also experiencing inflammation or disruptions in blood cell production, weakness may become even more pronounced. If fatigue lasts for weeks and does not improve with rest, hydration, or proper nutrition, it is essential to seek medical evaluation. Early diagnosis and treatment can help restore energy levels and improve overall quality of life. 7. Unexplained weight loss. Losing weight without making deliberate changes to diet or exercise routines can be a major warning sign that something is wrong in the body, including the possible presence of bone cancer. People may start noticing looser clothing or a thinner facial appearance without any effort to lose weight. This symptom often occurs because the tumor alters metabolism, requiring the body to use more energy than usual. As a result, patients may burn calories at a faster rate, leading to unintentional weight loss. Additionally, chronic pain, inflammation, and a possible loss of appetite associated with cancer may further contribute to the decline in body weight. If significant weight loss occurs without explanation, it is crucial to consult a doctor to identify the underlying cause. 8. Fever or night sweats. Some individuals may experience sudden temperature spikes at night or wake up drenched in sweat, even in cold weather. These episodes are often accompanied by daytime fatigue, as sleep is frequently interrupted or affected. These symptoms may be caused by the body's immune and metabolic responses to the presence of a tumor, leading to internal inflammation. If fever and excessive night sweating become recurrent and occur with increasing frequency and intensity, it is essential not to overlook them. The earlier the diagnosis, the greater the chances of beginning the appropriate treatment and maintaining quality of life. If you notice these symptoms repeatedly, do not hesitate to seek medical evaluation. Although bone cancer can sometimes develop silently, there are steps you can take to reduce the risk and increase early detection. How to prevent bone cancer. 1. Know your family medical history. Understanding your family's medical history can be essential in assessing your risk. Some types of bone cancer have genetic components, meaning that individuals with a family history of the disease may have a higher predisposition. If your parents, grandparents, or siblings have had bone cancer or other hereditary conditions, share this information with your doctor. This can help determine if preventive screenings or closer monitoring are necessary. 2. Avoid unnecessary radiation exposure. Medical imaging tests, such as X-rays and CT scans, are useful diagnostic tools, but excessive radiation exposure over time can be harmful. Always follow your doctor's recommendations regarding these tests and only undergo them when medically necessary. If you work or live in environments with radiation exposure, use protective equipment and adhere to safety guidelines. Reducing unnecessary radiation exposure helps minimize the risk of cellular changes in bones that could lead to tumors. 3. Monitor pre-existing health conditions. Certain conditions, such as Paget's disease, chronic arthritis, or osteoporosis, can weaken bones and, in some cases, increase the risk of serious complications. If you have already been diagnosed with a bone-related health condition, it is essential to attend regular medical checkups to monitor any changes. Your doctor may recommend periodic imaging tests to detect early signs of abnormalities in bone structure. Identifying potential issues in their early stages can lead to more effective treatment. 4. Maintain a healthy lifestyle. Taking care of your body through proper nutrition and exercise is one of the most effective ways to protect bone health. Eating a diet rich in nutrients such as fruits, vegetables, legumes, and lean protein strengthens both the bones and the immune system. Regular physical activity, especially exercises that involve mild impact or muscle strengthening, helps maintain bone density and strength. Avoiding smoking and limiting alcohol consumption also plays a crucial role, as these substances negatively affect circulation and bone tissue quality. A well-maintained body, particularly after the age of 50, is better equipped to respond to potential threats like bone cancer. 5. Focus on early detection. Even with a healthy lifestyle, bone cancer can sometimes develop unnoticed. Therefore, it is important to remain aware of symptoms such as persistent pain, unusual swelling, or fractures that occur without significant impact. If any unusual symptoms last for more than 2 weeks, consult a healthcare professional. Diagnostic tools such as X-rays, MRIs, and, in some cases, biopsies can help quickly clarify potential concerns. The sooner a diagnosis is made, the higher the chances of successful treatment and preserving quality of life. Bone cancer is a serious condition that can often be mistaken for common joint or muscle problems. However, paying attention to the warning signs and taking preventive measures can make a significant difference in early detection and treatment success. If you're concerned about your bone health, do not ignore persistent symptoms. Seeking medical advice at the right time can help ensure better health and a higher quality of life.